Hi, everyone, and welcome to today's webinar, Why Patients Don't Pay, What Providers Should Know. This is Mackenzie Bean, Managing Editor at Becker's. Thank you all so much for joining us today. Before we begin, I'm going to walk through a few quick housekeeping instructions for our audience members. We'll begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access that recording. If at any time you don't see your slides moving or you have trouble with the audio, please try refreshing your browser. You can also submit any technical questions into the Q&A box, as we are also here to help. With that, I am so pleased to welcome today's speakers. First, we'll hear from Chris Cox, who is the Senior Vice President of Product and Strategy at Vita Financial. Chris leads enterprise growth initiatives, including product management, strategic business development, and company-wide operations for Vita Financial. What he really enjoys is helping hospitals understand how they are performing against their patient collection targets and discussing ways to improve their results. Prior to joining Vita Financial, Chris worked in the financial services industry as an investment analyst, advising business leaders on key acquisitions. Joining Chris will be Paul Jaragowski, who is the Vice President of Healthcare Sales at Vita Financial. Paul leads the healthcare sales team and has worked in the healthcare industry for more than 30 years. He brings a proven track record in helping health systems unlock the value in their revenue cycle and improving financial outcomes, as well as in building and developing high-performance sales and account management teams. Before joining Vita, Paul held leadership roles at nThrive, WebMD, and United Health Group's Ingenix. Chris and Paul, thank you both so much for being here today. I'll now turn things over to Chris to get us started. All right, Chris, it sounds like you might be on mute.
Sorry about that, I was. Thank you. Thank you, Mackenzie. Hello, everyone. We've got a lot of great information to cover in today's webinar. First, we'll review the results of a recent patient survey highlighting what patients think about their experience paying for healthcare. Second, we'll walk through some of the same questions we asked patients, but instead we asked them to hospital CFOs and revenue cycle leaders to better understand how hospitals perceive what their patients actually want. We'll also discuss the most recent trends in patient collections and how hospitals are investing in various strategies in 2021 and beyond. Third, we'll compare and contrast several extended payment options commonly used today. In this section, we'll take a deeper dive specifically into payment plans, recourse lending, and non-recourse lending. And lastly, we'll wrap up and take questions at the end. So let's jump in and start with the patient survey. We conducted a survey of 435 patients who received healthcare services within the past 24 months. There was an even representation of age groups, as well as an even 50-50 split of patients who had scheduled procedures versus unplanned care. Also, I think you'll see the payer mix represented in this study is in line with what you would see in a typical acute care hospital facility. But before we dig into the results, I'd like to set the stage with a statistic that probably everybody on this webinar has seen. 40% of Americans surveyed said they would be unable to cover a $400 emergency with cash, savings, or credit. We wanted to dive into this statistic from the Federal Reserve and better understand what it meant specifically for patients receiving healthcare services. And here's some interesting bits of information we found. Over 1/3 of patients are worried about how they're going to pay for healthcare, which is in line with the Federal Reserve's statistic. Nearly half of patients indicated they were likely to skip treatment over concerns of affordability. And over 50% of patients indicated they preferred more options from the hospital to pay for their medical bills. and this was fairly consistent across all age groups. Understanding there's a general theme of patients having anxiety or concern over paying for healthcare, we asked patients to rank in level of priority how they pay their bills. We had always assumed patients did not prioritize or budget for healthcare expenses in their lives, and our thoughts were confirmed. We found bills associated with everyday living expenses were almost always prioritized over paying a healthcare bill. We also found, which was very interesting, was that over 1/3 of patient respondents who had to find an alternative payment source, like friends and family, to help pay for their hospital bill. And understanding that patients did not prioritize their hospital bill, and quite a few of them needed to help paying their bill, we asked patients how much of their hospital bill did they end up paying at the end of the day. 2 out of 3 respondents indicated they paid less than half of what they owed, and over half of those patients owed less than $1,000. So the patients in our study were dealing with fairly typical average balances seen at a healthcare system, and were still challenged to meet their full obligation. We asked those patients who did make a payment what payment method they used. We were surprised to see such a large percentage of patients answer with some form of cash payment, well over 50% when you add together cash, plastic, and check payment options. This finding lends itself to the notion that many patients seeking healthcare services do not have access to traditional credit markets, and think like credit cards, installment loans, etc., allowing them to make payments over time and in an affordable nature. As typical with credit card purchases, the interest component can be fairly punitive. The average APR on credit cards in the United States right now is around 18%. Of the patients who did use credit to pay for their services, over 50% of them actually incurred interest expenses. Having to pay interest on an already challenging financial obligation only adds to the patient's payment concerns. When asked when patients prefer to make payments to the hospital, we were pleasantly surprised to see that there was a strong representation at pre and point of service. This is great news for hospital systems who have invested in rigorous financial clearance processes. What's also interesting is looking at this breakdown by age group. 71% of Gen Zers prefer paying prior to leaving the hospital, compared to 60% of millennials, 36% of Gen X, and 29% of baby boomers. Another interesting finding was how patients preferred to be engaged. Most preferred physical written notification, like a patient statement. But what was very interesting was that the least preferred method was a phone call. Digital forms of communication like email and text messages were universally preferred over phone calls. Yet most providers prioritize phone calls, i.e. early out, over emails and texts. There appears to be an opportunity here to improve patient sat and engagement by leveraging these digital tools. And finally, when we asked patients about the effectiveness of extended payment options, the responses were overwhelmingly positive. Roughly 80% said they would go back to the hospital if extended payment terms were available. 74% would recommend to their friends and family if offered an extended payment option. And 65% indicated the lower financial burden would actually improve their overall patient experience at the provider. So to summarize the findings from our patient survey, there are 3 main takeaways. 1, patients prefer to have multiple payment options. This includes the ability to pay cash, leverage credit, or use a hospital-sponsored payment plan or loan program. 2, patients prefer a combination of statements, texts, and emails over phone calls. I think in general, the industry is seeing a shift away from human interaction and more towards a digital experience. And lastly, we're seeing patients are increasingly wanting to pay for treatment at or before the scheduled procedure at the hospital. And I think we're seeing the impact of consumerism in healthcare. So with that, I'll turn the presentation over to Paul to discuss the CFO survey perspective.
Hey, thank you, Chris, and good afternoon. Welcome to Thursday. We're almost there. So the interesting aspect of this survey conducted was not only to provide insights from a patient perspective, but also to provide a comparison between the patient versus the hospital's perspective. And I think you'll find this interesting. So the provider survey we conducted this past September included 95 hospital leaders, with 45% of those being executives, being CFOs, with the remaining executive leadership roles really falling in that revenue cycle area. And the size of the hospitals range anywhere from less than $100 million in net patient revenue to greater than or equal to a net patient revenue of $1 billion. The hospital information systems that were used at these hospitals included the usual suspects, the Epic, Cerners, Meditech, Allscripts, and others. So overall, I think we had a good mix of hospital representation in the survey. So one of the comparisons we thought you'd find interesting really centered around patient-friendly billing. And, this has been a hot topic for several years. So 80% of the hospitals believe they have a very or fairly patient-friendly billing process compared to 69% of the patients. So the patients don't think the process is quite as friendly as hospitals, but the good news is we're getting close, and I think hospitals have made a huge stride in this area, but there's still a difference. And as we all know, if a patient is confused about their bill, they're not going to pay. And so though we have come a long ways, the patient feels like there's still an opportunity for improvement. So what is the patient versus the hospital's perspective on primary payment methods? And, hospitals believe patients pay overwhelmingly by credit card, and they do. But the interesting aspect, patients do value other methods of payment, HSA, FSA, payment plan, et cetera. So the patient, paying by an HSA card is a very different decision than paying by a debit card. And I think the survey indicated patients value payment options. So hospitals may want to examine all payment options you provide to your patients. And more importantly, confirm with your staff, when they're speaking to a patient, can they easily discuss and accommodate multiple payment methods to meet the patient's payment preference during the financial clearance process. So the next area that we kind of examined is patient preference for the time of payment. I think Chris touched on this. What is the hospital versus patient perspective on when patients prefer to pay for the service? And I think you'll find this interesting. As you know, most of our payments still come in post-services, but the survey indicated that patients do have a preference to pay pre-service and point of service. Hospitals have, as Chris indicated earlier, invested a major amount of investment in technology, process redesign, training their staff to financially clear the patient earlier in the revenue cycle. And as a result, I think we're starting to see a cultural change. According to the patient survey, 50% of patients want to know their out-of-pocket expense before services are rendered and have a desire to pay pre-service or point of service. So with that being said, I think hospitals will benefit by continuing what they're doing. I think investing in having a strong financial clearance process earlier in the revenue cycle, have strong communication scripts available for their staff, allow the staff to provide multiple payment options earlier in the revenue cycle, and by doing so, I think hospitals will see a financial performance and patient satisfaction improvement. Now, one of the things that we're interested in is understanding how these high deductible plans are driving larger out-of-pocket expenses to the patient and the impact of that. So how likely are patients to cancel or skip services due to payment concerns? And providers and patients' perspectives are really tightly aligned in this area. If the patient has a payment concern, there is a good chance they will cancel. So payment concerns equal no-shows, cancellations. Let me say that again. Payment concerns equal no-shows, cancellations. So it's important hospitals provide patients with an affordable payment options to address their payment concerns. And as a result, I believe we'll see improvement in utilization in addition to a reduction in patient leakage. Another area that we examined is kind of what is the importance of an extended payment option. Many of us know that the overall satisfaction of a patient is really driven by two factors, and that's, what was the clinical care they received, but as important, what was their financial experience? And a key component identified in the survey was establishing a positive financial experience. The patient is looking for, one, an affordable payment to be paid over an extended period of time. So it's critically important. So when a patient has a positive clinical and financial experience, there's a high likelihood the patient will seek treatment at that hospital again and refer others to the hospital. So again, both components, clinical and financial, are critically important. And the next portion of the survey was really designed to uncover what providers are doing to improve patient satisfaction and financial performance. And one of the things this survey brought to light was there doesn't seem to be any prevailing program that drives higher collection yield. Rather, it's the use of multiple programs working in conjunction with one another tend to yield the better overall performance. So self-pay collections has always been a challenge for all hospitals, and now we introduce COVID. And so hospitals are facing an additional level of challenge. COVID has impacted staff, workloads, hiring of quality staff, and it's really challenged, many of the patients' ability to pay. So with all these new challenges, we wanted to kind of understand what revenue cycle leaders are doing today and plan to do to improve patient sat and self-pay collections and their performance through 2022. So we surveyed the hospitals, and we tried to identify top strategies they plan to implement in the next 12 to 24 months. And the top initiative was digital capabilities, example, communication via text messaging, combined with self-service payment and payment arrangement portals. So the good news is this falls in line with our market research. Consumers have a desire or preference toward a digital experience. We found that more and more consumers love the convenience of using their smartphone for communication or making payments. Customers had indicated that they want to have access to a self-service capability after hours and weekends and gravitate toward digital communication, texting, and email as a preferred method of communication. So this survey is indicating that patients' desire for digital communication, and the good news is hospitals acknowledge this desire and are acting on it. We also surveyed hospitals really to kind of determine which programs seem to be the most effective for patient collections. And hospitals ranked the following initiatives as being the most effective. Rank number one was a customized payment option to include third-party loan programs, followed by the second, staff incentives, and I'll assume these incentives are designed to reward staff behavior. Getting staff to ask for payment has never been that easy. The third being a one-time discount, and I'll assume these discounts are given to provide a reason for the patient to pay now. So when we think about the first ranked initiative, customized payment options to include a third-party loan program. This truly supports kind of the patient survey results we reviewed earlier in the presentation. The patients are looking for a customized approach with multiple payment options to meet their financial obligations. So I'm going to stop here and do a polling question. And for those of you representing hospitals on the line, I'd really be interested in your feedback. And so the question is, do you currently have a third-party patient lending program in place at your facility? And please choose one of the responses. Yes, we currently offer a lending program. Not yet. We are planning to offer in the next 12 to 18 months. Not yet. We are considering it. Or no, we don't plan on offering it, or not sure. So please select your response, and we'll give you a little bit of time, and we'll share the results with you shortly. Okay, so let's look at our results. Okay, so yes, we are currently offering a lending program, 27%. Not yet, but planning on doing it in the next 12 to 18 months. Not yet, we are considering it. And then no, we don't plan to offer it, and not sure is at 35%. I appreciate the feedback. The reason being that we conducted the same survey with the hospitals that we were part of our survey, and I'd like to share with you kind of the results of our survey internally with our group of 95 executive leaders. And so of the hospitals we surveyed, it's pretty much in line. 1 out of 4 have already implemented a third-party financing program. And we have another 25% of those hospitals we surveyed that were considering implementing a patient program, financing program, within the next 18 months. So this is pretty much in line with the survey, the polling question that we just had. So some additional feedback that I think you might find interesting about these third-party programs is that those hospitals that have implemented a third-party financing program, 85% of those said it really improved their patient collections, and 82% of it improved patient SAT. So, with these results, I can see why it has been one of the more effective programs hospitals have put in play. So with third-party programs, we wanted to understand kind of what was the most important considerations for hospitals when selecting and implementing a third-party patient financing program. And the most important consideration the hospitals identified really fall into 3 categories. The most important consideration was being patient SAT. The hospital said, please take care of my patients. They want their patients to have access to the best, extended payment options, affordable payment amounts, 0% interest, something simple, something fast, and they wanted a very patient-friendly collection process. They did not want something very aggressive. The second consideration had to do with financial performance. Hospitals are looking to accelerate cash. Cash has always been king. And so, the program and its ability to improve self-pay collection performance overall was critically important to them. And the third item I kind of categorized as minimal effort. And, hospitals are saying, we want this simple. We want this fast for our staff to operationalize. We also want this complementary to our current clearance process. And we want the implementation to be simple, quick, and involve minimal IT resource requirements. So I think those were the 3. So patient SAT, make sure my patient has a positive experience. Financial performance, improve my self-pay collections, and minimal effort. Fast, simple implementations, and please do not require me to engage IT if possible. So in the next segment of the presentation, Chris will take a deeper dive into patient financing and how it can help improve collections for you. So, Chris.
Thanks, Paul. In this final section, we'll cover how extended payment options like patient financing can help improve cash collection goals and increase patient sat. But first, I want to hop in here and just complete another poll. And this one is always interesting to see how everyone responds. What is your total patient collection rate on dollars billed to the patient? This includes all patient balances. So think true self-pay, balance after insurance, et cetera. And don't be shy, these results are anonymous. I'll give you guys a few seconds to answer, and then we'll go ahead and review the results. All right, so the results looks actually fairly consistent with what we've seen, and I'm actually not surprised at all that it is not uncommon to not completely know what the patient collection rate is. But it is good to see that there aren't any in the 0 to 5% bucket. So when we polled our panel of revenue cycle leaders, 42% of providers believe, and with a high degree of confidence, they're collecting over 30% on total patient balances. What we found through our own internal data study analysis, and also supported by Crowe-Horwath's research, points to a more challenging patient collection rate. And let me share with you those findings. And keep in mind, despite all the tools currently deployed at health systems today, that includes propensity to pay scoring, patient estimates, early out, bad debt, et cetera, what we've seen is that the average collection rate on all patient self-pay balances is around 12% or lower to mid-teens. Now, obviously this differs by provider, but effectively, out of 100% of the amount billed to patients, 88% of that balance goes on to be uncollected. And this is where patient financing comes in. By introducing a patient financing tool, what you're effectively doing is transferring the risk of repayment over to the lender and receiving the funds at a much higher rate than which you would have collected on your own, while also providing the patient with an affordable way to pay their balance over time. The benefits of a program, a patient financing program, would ultimately allow providers to reduce their cost to collect and increase patient satisfaction. It can also reduce canceled procedures if offered pre-service, giving patients peace of mind that there's an easy way to pay for their care. The ability to reduce risk depends on the type of financing you choose. The difference between payment plans and loan programs can be complex. So I'm going to poll the group again to kind of gauge your temperature on how comfortable you are in describing recourse versus non-recourse. So do you know the difference between recourse and non-recourse patient financing? If you understand the difference and could explain it to somebody like a peer or a colleague, choose yes. If you think you understand the differences but you aren't entirely sure, choose option 2. If you truthfully don't know the difference, which is completely fine, choose option 3. And I'll give everybody a little bit of time to respond. Great. It looks like we got nearly 50% of the attendees to respond. And the answers are yes at 45%, so nearly half understand recourse versus non-recourse. About a quarter are saying sorta, kinda, yes, maybe, and then a third of the group doesn't really understand. So, which is perfectly fine. It's great. So this next slide will kind of highlight the differences between payment plans, recourse lending, and non-recourse lending. And I apologize in advance. It's a busy slide with a lot of information. But in summary, payment plans are not loans, but they're very easy to implement, but can be difficult to manage as the portfolio grows. They're pretty unwieldy to manage from an overhead perspective. And you also lose out on the cash acceleration benefits that you get with financing. Recourse lending helps accelerate cash and improve collections, but the risk of repayment ultimately falls on the hospital. So what a recourse loan is if the patient defaults on the loan, the provider is essentially on the hook for the balance. So the loan unwinds itself and the balance is placed back to the hospital. So not unlike a payment plan where if the patient doesn't pay on the payment plan, the hospital is responsible for the balance. If the patient doesn't pay on a recourse loan, the hospital is stuck with the balance. For non-recourse loans, you immediately accelerate cash and improve collections, but you eliminate the risk of repayment to the hospital and avoid any type of reconciliation efforts on the back end. I just say make sure as you're evaluating this, these options, understand how non-recourse programs are priced and how patients qualify for the service itself. And keep in mind, no two lending programs are the same. That goes for both recourse and non-recourse financing. Regardless of which program you choose, you should ask the following questions. 1, how easy is it to implement? 2, are my patient's credit scores taken into consideration? And if so, how? Is there a cutoff? 3, what triggers funding from the lender? Is it, do you receive funding right away? Do you receive funding only when the patient pays? Does the patient have to make a payment before the loan is funded? 4, are there any hidden fees or interest to my patients? And 5, what is the patient experience like? And I highly recommend requesting to see a demo of not only what the patient experience is like, but also for your staff as well. Here at iVita Financial, we offer a non-recourse solution that is 0% interest with no fees to the consumer ever. And that goes for late fees and NSF fees as well. It's available to all patients regardless of their credit score, and we fund the hospital immediately at discharge for the full balance. Our line of credit program is reusable for both past and future charges. It is available to the guarantor's entire family as well. We do not require a reserve account, and we never ask the provider to pay us back on defaulted loans. If the patient defaults, that's on us. Our pricing model is simple and straightforward. We take a small discount of the loan proceeds as our service fee, meaning you receive the vast majority of the balance up front without ever having to collect it yourself or having to worry about the defaulted loans being placed back to you. And I'd like to share some feedback patients are saying about our program. In short, they appreciate how quick and easy it is to apply and manage their loan with iVita. We're very proud of the fact that 90% of our patient borrowers are very likely to recommend our program to friends and family. And conversely, our providers have given us a satisfaction score of 4.9 out of 5, which is incredibly humbling. So with that, I wanted to thank you for everyone's attention today and participating in the polls. And I'll hand it back to Mackenzie to help answer any outstanding questions that you may have.
Wonderful. Well, Chris and Paul, thank you so much. This has been a fantastic presentation. So interesting to see some of these survey findings. So we appreciate you sharing them. We'll now go ahead and start today's question and answer session. You can submit any questions you have by typing them into the Q&A chat box you see on your webinar console. We've already had a lot of great questions rolling in, so let's get started. The first is from an audience member who is asking, are these loans made by the hospital on behalf of patients, or does the patient apply directly through Vita Financial?
Mackenzie, I'll take this one.
You want to?
Let me read. Yeah.
Okay.
Yeah, I'll take it. Let me read it one more time. Okay. Yeah, this is actually a good question. So, establishing a line of credit, at least with iVita, is a really simple process, and it involves two steps: one from the hospital staff, and the other from the patient itself. So, in the first step, the hospital staff is actually facilitating a pre-approval process. If the patient is interested in the program, the staff member accesses our application, confirms and enters a minimal amount of information about the patient, and then submits a request for pre-approval. This process might take a minute for the staff, and within seconds, the staff and patient know if they're pre-approved. The second step is once pre-approved, the patient will receive an email or a link to set up their account. And setting up the account, again, is a simple process, maybe 3 to 5 minutes. And, it can be done on their smartphone, their tablet, laptop. But really, these are the two steps. But once they've completed this process, they're done. I think it's a good question. Thanks, Mackenzie.
Yeah, of course. Thank you, Paul. It's helpful to hear. The next question is from someone who is asking, how does the hospital get funded back for the loans the patients take out?
Chris,
I'll take it, Paul. The financing as soon. So for our program, it's a good question to ask any loan program. For our program, as soon as we confirm that services have been rendered at the hospital, we fund the provider that following Monday. So we don't wait to confirm that the patient is making payments on the account. As soon as we receive the application from the patient, have originated a loan and confirm that services were rendered, we go ahead and fund that next Monday.
Got it. So quick turnaround. Thanks, Chris. We have another audience member here asking, what happens when the patient doesn't pay back their loan?
Yeah, I see this one popping up a little bit in several different areas, and so it's a great question. So, we're highly motivated and have a strong desire for a successful outcome for all of our patients, but they are right. Defaults do happen. As Chris reviewed earlier in the presentation, we're a non-recourse financing company. Thus, if the patient does default, we'll assume the risk and we'll never go back to the hospital and ask for a refund. So, good question.
Yeah, and I'll add to that too. From the collection standpoint, iVita does not, in the event that there is a default, we don't sell the loan. We don't currently report to credit bureaus, and we don't send the account even through a collections effort. So we work with the patient in-house for 60 to 90 days and just try to work with them to get them back on track to successfully pay their loan back.
Got it. That's helpful to know. Thank you both. Yeah, thanks for weighing in there, both of you. Appreciate it. The next question is from an audience member saying, if I already have a payment plan program in place, why should I consider adding a loan program?
Yeah, I'll tackle this. It's a phenomenal question. So I've actually seen kind of two schools of thought here. The first being the provider runs a really efficient payment plan program. They've got a lot of rigor and structure in their financial clearance process, and the payment terms are typically shorter in nature. adding a patient financing option could be used to allow your patients to make payments over a longer period of time, thereby kind of making the actual payment they're making every month more affordable to the patient. The second school of thought is that some providers are kind of just stuck in payment plans because they've been offering payment plans forever, and patients are enrolled in payment plans of $15, $25 a month forever, and they want to get out of that business, and they want to kind of get themselves out of managing a gigantic book of AR, get the balances off their books, and have someone else service their loans or service their balances and making sure their patients are happy and paying down their accounts.
Great. Thanks again for chiming in there, Chris. I appreciate it. We have another question more about the cost of the program. The question is, what is the cost for the program to the hospital?
I'll take this one, Chris. Yeah, I'll take it. Let's see. So, currently we have two service models that we put in place associated with funding and fees. And the first model is really based on a propensity to pay of the patient. So the higher the propensity to pay of the patient, there's a higher amount we fund to the hospital. And that funding rate ranges anywhere from 90 to 70%. So that would be one option. The second service fee model that we make available to our hospitals is a fixed fee model. And so, we work with a hospital, gather information such as patient volumes, average patient out-of-pocket expenses, and other data, and we arrive at agreed upon fixed funding rate with the hospital and the system itself. So really, one's a fixed and the other one's really based on a propensity to pay score. Good question, though.
Yeah, nice that there are two different options, I think. Helpful for our audience to know, so thank you there. The next question is there a minimum and maximum loan amount for patients with iVita Financial's program?
So there is. Our minimum balance is $500, and the maximum loan amount that we go to is $8,000. And a follow-up question that I'll answer is, why did we set those balances? We typically see that providers do a really good job of collecting balances less than $500. And then the ceiling for the $8,000 was basically designed to cover most high deductible healthcare plans that we see out in the market today. And I'd like to just quickly chime in. I'm seeing some chatter in the Q&A. I just wanted to clarify on the previous question where what happens if a patient doesn't pay. If the patient doesn't pay and we can't get them back on track after the 60 to 90 days, we chalk the account up as a loss, and we don't sell it, we don't send it to collections, we don't do anything.
Great. I'm glad you clarified that, Paul. Thank you. And thank you, Chris, for weighing in on that minimum maximum amount as well. A few more questions here. The next is from someone who is asking, can the loan be used with a different provider in the same health system?
Paul, that's got your name written all over it.
Yeah, and so the answer is, yeah, if the provider is employed by the hospital system, the answer is definitely yes. So each hospital system that we work with identifies and approves which facilities and providers that will have access to this financing service. This is a line of credit that can only be used at an approved facility identified by the hospital. So, it's a good question.
And one more related question here. Can the loan be used for previous balances?
I should probably take that one. The answer is yes. Once a line of credit is established, a previous balance would be an example. It can be added, not a problem. So again, this isn't a loan amount. This is actually a line of credit. And it's tied to approved hospital facilities, but also the line of credit, I think Chris had mentioned it earlier in the presentation, this line of credit is tied to the guarantor. Thus, the guarantor, any family member under that policy has access to this credit line, and it can be used for their out-of-pocket medical expenses. Is a good question.
Wonderful. Well, Chris and Paul, I just want to thank you so much again for your time, such a thoughtful presentation today, and thank you as well to Vita Financial for sponsoring today's webinar. I encourage everyone to please check out the content that is in your resources section on the webinar console. We have lots of great information there if you're interested, and be sure to fill out the post-webinar survey. Thank you all so much for joining us, and we hope you have a wonderful rest of your day.